Prostatectomy, the surgical removal of the prostate gland, is a common procedure primarily performed to treat prostate cancer, though it is also used for severe benign prostatic hyperplasia, BPH. While the surgery can be life-saving, it is not without significant consequences that affect both immediate and long-term health. Understanding the full range of effects on urinary and sexual function, as well as emotional well-being, is crucial for managing life after prostate removal. Here's an in-depth look at what to expect, potential complications, and strategies to optimize recovery. One of the most immediate and often distressing changes following prostatectomy is the impact on urinary control. The prostate gland surrounds the urethra, the tube that carries urine from the bladder to the outside of the body. Its removal can disrupt normal urinary function, leading to issues like urinary incontinence, which is one of the most commonly reported side effects. Urinary incontinence after prostatectomy can manifest in several forms. Stress incontinence, where urine leaks during activities that put pressure on the bladder, such as coughing, sneezing, or lifting, is particularly common. Urge incontinence, characterized by a sudden, intense urge to urinate followed by involuntary leakage, can also occur, though less frequently. For some, these changes are temporary, resolving within weeks to months as the body heals. However, a subset of men may experience persistent incontinence that requires long-term management. Recovery of urinary control largely depends on the individual's overall health, age, and the specifics of the surgical procedure. Pelvic floor exercises, often known as Kegels, are a cornerstone of incontinence management. These exercises strengthen the pelvic muscles that support the bladder and urethra, enhancing control and reducing leakage. Regular practice, guided by a physical therapist specializing in pelvic health, can yield significant improvements. Medications, such as anticholinergics, may be prescribed to manage bladder spasms and reduce urge incontinence. In more severe or persistent cases, surgical options like urethral slings or artificial urinary sphincters can be considered to provide additional support to the urinary tract, helping restore normal function. In addition to incontinence, changes in urinary flow are common immediately after surgery. Many men experience a temporary reduction in flow due to inflammation and the body's healing response. However, urinary flow typically improves over time as swelling decreases and tissues adjust. For most, these changes are manageable, but ongoing communication with healthcare providers is essential to address any complications that may arise. The nerves responsible for erections are located near the prostate, making them particularly vulnerable during prostatectomy. Even with advanced nerve-sparing surgical techniques, erectile dysfunction, ED, is a common outcome, affecting nearly all men to some degree immediately after surgery. The extent and duration of ED vary widely, depending on factors such as the patient's age, pre-surgical erectile function, overall health, and whether nerve-sparing techniques were successfully employed. Nerve-sparing prostatectomy aims to preserve the neurovascular bundles that control erections, but this is not always possible, especially if cancer is extensive or located near these critical nerves. Consequently, many men experience temporary ED, with the potential for gradual improvement over months or even years. However, for others, especially those with significant nerve damage, ED may be a permanent issue. To manage ED, several treatment options are available. Oral medications such as PDE5 inhibitors, e.g., Viagra, Cialis, Levitra, are often the first line of treatment. These drugs enhance blood flow to the penis, helping to facilitate erections. If oral medications are ineffective, other therapies like vacuum erection devices, penile injections, or urethral suppositories can be explored. In cases of severe or unresponsive ED, penile implants provide a more permanent solution, allowing men to achieve an erection suitable for intercourse. Early intervention with penile rehabilitation programs, including the use of medications and devices shortly after surgery, can help maintain erectile tissue health and improve the chances of regaining function. These programs aim to stimulate blood flow and prevent the tissue changes that can occur when the penis is not regularly erect. Prostatectomy not only impacts erectile function, but also alters ejaculation and orgasm. The prostate and seminal vesicles, which are removed during the surgery, produce the bulk of semen. As a result, men will no longer ejaculate semen, a condition known as dry orgasm. While the ability to achieve orgasm usually remains intact, the sensation can feel different, and the absence of ejaculatory fluid can affect the overall sexual experience. For some, the change to a dry orgasm can be psychologically challenging, altering how they perceive their sexual identity and satisfaction. It's important for men to understand that this change is a normal outcome of the surgery and does not diminish their capacity for sexual pleasure. Additionally, the removal of the prostate results in infertility, as semen is no longer produced to carry sperm out of the body. For men who wish to father children post-surgery, options like sperm retrieval from the testes and assisted reproductive technologies, such as in vitro fertilization, IVF, offer pathways to conception. For those undergoing prostatectomy due to cancer, the primary goal of the surgery is to remove the cancerous tissue and reduce the risk of disease spread. Prostatectomy is highly effective when cancer is localized within the prostate, offering a potential cure. However, the success of the procedure depends on complete cancer removal and the absence of cancer cells at the surgical margins. In some cases, despite successful surgery, additional treatments may be recommended. Radiation therapy is often used post-prostatectomy if there is a risk of residual cancer cells or recurrence. This therapy targets any remaining cancerous tissues in the prostate bed, helping to ensure that the disease does not return. Hormone therapy, which lowers testosterone levels that fuel prostate cancer growth, may also be used as an adjunct treatment in higher-risk cases. Regular follow-up with PSA, prostate-specific antigen, testing is crucial for monitoring cancer status after prostatectomy. Rising PSA levels can be an early indicator of recurrence, prompting further investigation and possible intervention. The effects of prostatectomy extend beyond physical changes, significantly impacting mental and emotional health. The prospect of cancer recurrence, coupled with changes in urinary and sexual function, can lead to anxiety, depression, and challenges in self-esteem. Many men report feeling a sense of loss related to their sexual function and body image, which can strain intimate relationships and overall quality of life. Support from healthcare providers, including urologists, oncologists, and mental health professionals, is vital in helping men navigate these challenges. Counseling, whether individual or as a couple, can provide a space to express fears and concerns while developing coping strategies. Support groups offer connection with others who have undergone similar experiences, fostering a sense of community and shared understanding. Recovery from prostatectomy is a gradual process that requires time, patience, and support. Physical activity, particularly gentle exercises like walking, is encouraged to promote healing and improve urinary control. Over time, more strenuous activities can be reintroduced based on comfort and recovery progress. Dietary adjustments, including maintaining a balanced diet rich in fruits, vegetables, and lean proteins, can support overall health and aid in recovery. Avoiding bladder irritants like caffeine, alcohol, and spicy foods may help manage urinary symptoms during the healing phase. Regular follow-up with healthcare providers is essential to monitor recovery progress, manage any complications, and adjust treatment plans as needed. Open communication about concerns, symptoms, and changes can help ensure that the right support is in place. Prostatectomy is a significant medical intervention with profound impacts on various aspects of life. However, with appropriate management, support, and a proactive approach to recovery, many men can adapt to these changes and maintain a high quality of life. Understanding the potential effects, setting realistic expectations, and seeking help when needed are key to navigating life after prostate removal. Navigating life after prostatectomy can be challenging, but with the right knowledge, support, and proactive management, many men can regain their quality of life. From managing urinary incontinence to coping with changes in sexual function, it's important to remember that every individual's journey is unique. Staying connected with your healthcare team, exploring available treatment options, and leaning on support networks can make a significant difference in your recovery. If you or someone you know is facing prostate removal, understanding what to expect and being prepared for the changes can empower you to take control of your health. Don't hesitate to seek guidance, ask questions, and explore the resources available to help you adapt to your new normal. Thanks for watching, and if you found this video helpful, please like, share, and subscribe for more insights into managing life after major health changes. Remember, you're not alone on this journey, and with the right approach, there's a path forward. Stay informed, stay healthy, and take care.